Welcome back everyone. Dr. Naveen here from UPSC Medico. We are discussing national health programs related to maternal health, and among this one of the important and latest program or a recent program is PMSMA. What is this? Pradhan Mantri Surakshit Matritva Abhiyan. PMSMA or Pradhan Mantri Surakshit Matritva Abhiyan. So this program comes under, yes, NRHM. To be more precise, it is again it is under RMNCH plus A, that is Reproductive Maternal Neonatal Child and Adolescent Health Program. Okay, under the strategy, and it is headed by Ministry of Health and Family Welfare. Let me put it this way: CH plus A and Ministry of Health and Family Welfare. And one take home, one very important thing that you need to remember is the whole program revolves around one important thing, that is, okay, this is ANC services, that is antenatal visits. Okay, so why there is a separate focus on antenatal visits? We already have in the regular PHCs, sub-centers and all, we request pregnant women to go and get regular checkups, at least 4 antenatal visits in a pregnancy, right? The mandatory is at least 4. Now, why there is a special stress or a special program for this? Okay, so for that, I want you to focus on two important factors here. One, first and foremost, is look at the logo here. If you're parallelly preparing for INA-CET or NEET PG exams, they're also asking logos and they're asking you to find out which program it is. Okay, there's a mother with both green color hands with a logo. Okay, so under the logo there is a sentence written. It is, what is this? 9th of every month. The special focus, we'll come back to the detail. The special focus here is we will be focusing on those women who haven't registered for ANC services. That means they haven't come for an antenatal visit, or dropouts. No registrations, are not registered, or dropouts. So these kind of women, pregnant women, are targeted under this program. Even if you are regularly attending an antenatal checkup, still you can find the ANC facility available under this program PMSMA in nearby locality through a website, and you can go there and get it checked. When you go for a special checkup on the 9th day of every month, you will find a specialist there. Okay, the specialist can be a private or a public. Like you will see a government specialist like an OBG specialist or a radiologist who is coming to visit that particular setup. So that setup is either PHC or it can be community CHC or a district headquarter. So any of the district hospital, you can go there on 9th of every month. You will see obstetrician or radiologist who is a specialist. Plus from private sector also, voluntarily doctors are coming on 9th of every month to these institutes to do a single window package system. That means they will do an antenatal checkup, a regular antenatal checkup. They'll also do an ultrasound, the radiologist, and they'll also give you iron, folic acid supplementation and also calcium supplements. So this single package, this single window package is provided there. So what is the difference between a regular antenatal visit and a visit on 9th of every month, that is hashtag I pledge for 9? So the difference here is you will find a specialist either from a government or a voluntary private specialist will be coming to this PHC or community, not sub-center, from PHC onwards. You will find them and they will, like, the whole intention or idea behind this program is at least once in your pregnancy, if a pregnant woman is being investigated or thoroughly examined by a specialist, then if he or she, the doctor, thinks that the patient is a high risk and needs a thorough or regular follow-up, and on regular follow-up we'll put a red sticker on MCP card, that is maternal and child health card. So when you put a red color card and followed thoroughly till the delivery and post delivery, I think that pregnant woman who is having a high risk but she doesn't know about it because of lack of antenatal visit by a specialist, now we can identify her, treat her and rescue her, and this is how we reduce maternal mortality rate. So one of the main intention, SDG, Sustainable Development Goal 3.1, says that the MMR should come down, okay, less than 70 per 1 lakh births. So India is towards achieving it, and the main aim intention of this program, that is Pradhan Mantri Surakshit Matritva Abhiyan, is that. Okay, so this is overall what is done. It is a single window system. A specialist will come, you will get iron, folic acid supplementation, calcium. Very importantly, a radiologist will do an ultrasound scan. Okay, and more focus on women who are dropouts or who haven't registered at all. There is a separate website available wherein you can check. There is a separate mobile app available wherein you can register. If you are, for example, you are a doctor, you are preparing for UPSC exam, somehow you're an obstetrician or a physician or a radiologist specialist, you want to do voluntary services under this program, I'll give you the details. You can just log into the website, you can register there, they will allot you some time slots, you can go and you can do a voluntary service there. If you do it properly and if you get appraisal and all, they will give awards also. There is a I+9 awards also available. Okay, you will be respected duly. No money or no compensation or no monetary gain. Only awards will be given. It's a voluntary service. You're not going to get paid. Okay, and Pradhan Mantri ji in Man Ki Baat in 2019 has requested Indian private doctors to voluntarily participate in this program. See, their belief is if one private doctor with adequate updated knowledge is going to examine one woman, pregnant woman, once in her pregnancy, if he is able to identify a high risk, put a red sticker on the MCP card, I think she will be followed carefully throughout her pregnancy so that we can rescue her from any mortality, right? So that's it. So this is all the program. So rest all the text, I'll highlight the important points so that you can focus there. So sometimes we get confused, what is this PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan? It's a fixed day on 9th of every month, comprehensive and quality antenatal service to pregnant women, and this is offered, this is very important, not in the first trimester but in second or third trimester. Please make a note of it. Second or third trimester, and as I told you, it is on the 9th of every month. 9th of every month. So what else do we have? As I already told you, the services are provided by OBG specialist, radiologist or physician at government health facilities only, not at private health facilities. Even if you are a voluntary private practitioner, you should go to the nearby facility, and there is a website available which will give you details about where is this facility available. Okay, there will be a minimum package of investigations and medicines such as iron, folic acid and calcium supplementation will be provided to all pregnant women, like a single window system. It's not just an OP consultation, you will get some investigations and also some medicines there. And very importantly, there is a follow-up of high-risk pregnancies and red stickers are added. This is the gist of I+9. So if in the exam, they'll not ask you gist. They'll ask you what is PMMSK, what is the goal and objectives. So then you have to elaborate the same thing in detail. So the goal is to improve quality and coverage of ANC, as I already told you. The objectives are at least one antenatal checkup for all pregnant women, that too in second or third trimester by a specialist. And also we have to improve the quality of care during antenatal visits by a single window system by also giving medications and investigations. So there will be diagnostic services, there will be screening for clinical conditions. If there is any clinical condition, appropriate management should be done. For example, anemia, pregnancy induced hypertension, gestational diabetes, they also should be treated. And there should be proper counseling services and proper documentation of services that are provided, and additional service opportunity to who have missed antenatal visits, and identification and line listing of high risk pregnancies based on the history and clinical condition, appropriate birth planning and complication readiness for pregnant women, special emphasis on early diagnosis and adequate and appropriate management of women with malnutrition, very important, and special focus on adolescents and early pregnancies, which contains which needs extra care because of lack of education and very young and tender age, right? So these are the objectives. So the key features we already discussed, let me highlight them again. Okay, that should be at least once during PMMSA, the woman should be examined by this thing, and antenatal checkup are provided by this thing. And where are they provided? PHCs, CSEs, district hospitals and urban health facilities. Okay, there will be investigations and drugs and ultrasound during second trimester of pregnancy. And very important thing, this can be an area where a lot of MCQs can come. Okay, so when you examine, okay, when you examine the woman, you'll see that the green sticker is given to women with no risk factors, whereas red sticker is given with a high risk pregnancy, blue sticker for pregnancy induced hypertension, and yellow sticker for any comorbidities like diabetes mellitus, STDs or hypothyroidism. So the color coding is placed on the MCP card. And as I told you, there is a national portal to find where is these services available, and you can even register there. And I pledged for 9 achiever awards have also been given by the government. So very importantly, it requires private and voluntary sector involvement. There's no money paid for these doctors, but definitely you will get an award from the government praising your efforts. Okay, so these are the details. If you want to register, just go through them. And very importantly, this is how you can search for the nearest facility. And I pledge 9 awards have been given, and what is the criteria for this is mentioned, not important for exam. Okay, so this will conclude our discussion on the PMSMA.